Hello and welcome to this special show called Inspire India on Mirror Now, where we feature the Good Samaritans, those who are working towards helping the needy and the underprivileged, braving the difficult circumstances. These are citizens who have displayed courage and compassion. They are working purely out of humanitarian concern to reach out those who have been hit the hardest by the lockdown, the migrant laborers, the senior citizens, those who are living under underprivileged conditions, those who have been rendered homeless or jobless because of the restrictions that are now imposed during the lockdown. So it is actually my proud privilege to introduce my guests this afternoon, two women Samaritans, Good Samaritans on Inspire India today. Let me introduce Dashmi Rani, who's a school teacher by profession, and Rinal Singh, who's an entrepreneur. So we are going to bring you the stories of Dashmi Rani and Rinal Singh. Let's talk about Dashmi first, and just to give a little background to the kind of work that Dashmi Rani is doing, a school teacher by profession with a passion for biking. That's interesting. We'll have to ask Dashmi to tell us more about that. But she's been now actively involved in helping the elderly in the outskirts of Bengaluru, and the way she operates will show in the visuals as well, where Dashmi has already covered 1,500 kilometers on her Enfield and has delivered medicines to senior citizens. So she's kept her eyes open for the elderly citizens who might require their essential medicines at a time like this, and makes sure that they are delivered to them. And she's covered a huge distance of 1,500 kilometers so far. Dashmi works in coordination with government's helpline also, and collects information on senior citizens and delivers medicines and essentials at the doorstep of the elderly. And just to give our viewers an idea about Mrinal Singh as well. Now here is an entrepreneur by profession who got this idea of setting up a community kitchen when a Delhi police inspector posted at Sarita Vihar police station, also his neighbor, spoke about migrant workers. That is when he started this project of a community kitchen, and the idea of preparing food and those stuck because of the lockdown is something that Mrinal is actively involved in feeding the migrant laborers. So welcome to the show, both Dashmi Rani and Mrinal Singh. Welcome. Thanks for joining us here on Mirror Now. So it's going to be, in fact, a pleasure and a privilege to actually hear from you. If I can ask you, Dashmi, first to tell us how you operate, how you came about this idea, and what has been the response that you are getting so far, because what you're doing is something very specific from what I can understand of reaching out to senior citizens. Tell us more about your story, please.
Hello. Actually, humanity, my main cause is humanity, right for humanity. So when I'm a free time, I feel like helping others, and also I'm a civic leader, so that I can do from my passion. I can take a little bit I can help many people.
But you are on a bike and you have covered this kind of a distance. How did you think of that? And isn't it difficult for a woman? And the reason that we are actually talking about your story today, which should be inspirational to many, is that a lot of times women feel constraints of transportation. They feel as if they cannot be out there doing these things. It's more considered to be the territory of men. But you are a biker as a passion. You do it, and then you are using it for a humanitarian cause. Tell us a bit about that, please.
Yeah, obviously, biking. It's not easy to ride a bike on the woman. It's a hot summer, and also it's a great courage. And I got an opportunity to do the work for the society.
But how do you get the contacts? How do you get the information? Because I was just reading about your story and I got to know that you are constantly in touch with the government helpline.
Yes.
Are you in a way compensating for what the government is unable to do, perhaps in terms of covering everybody who needs these essential medicines? And are you doing it purely on your own initiative?
Actually, I'm connected with the Department of Information, Public Relation Information about Bangalore. the CDP. I am working under the CDP West
Okay.
Zone in the Bangalore, and I'll get an information from the officer, Gaut.
Okay. Okay, but the way you are doing this is something that's inspirational. The fact that you, like you said, braving the harsh weather conditions, you're on your bike, you're covering a lot of distance to reach out to the senior citizens, because a lot of times they are not able to get their medicines. On paper, we keep hearing that the government is going to deliver on the doorstep many of these essential commodities in the hotspot areas, but in practice, on ground, a lot of times it does not happen. And that is where people like Dashmi are pitching in and doing such great service purely out of humanitarian concern. We salute the courage and the compassion that Dashmi is showing. I'll go back to Dashmi. Dashmi, stay on with us. Mrinal Singh is running this community kitchen, like I said. Mrinalji, if you can tell us about the number of people you're reaching out to, what is the kind of daily work on a regular basis? What exactly is your schedule like? How do you go about this project of feeding so many people every day? Okay, I am not able to connect to Mrinal Singh at the moment. If Mrinal Singh ji, if you can hear me, I wanted to ask you that this whole idea of setting up a community kitchen, how did you come to how did you take up this idea? What kind of support did you get? And at the moment, how many people exactly are benefiting from this initiative?
Yeah, thank you, at the outset for having us on this great show that you have, and my compliments to Rashmi for singularly, taking up a cause that is so much in vogue and so much in need right now. The genesis actually behind this idea, as you mentioned earlier, is Mr. Suman Kumar. He's the additional SHO at Sarita Vihar Police Station, where we reside, and that's our community. And it was actually the third day of the migrant problem that had happened, where it was a very, a day and night. It was raining in Delhi, and he was on night duty, I presume, and that's when he saw these laborers trying to walk, hundreds of kilometers with children in their tow to try and figure out a way to reach their places. So at around, past close to midnight is when I got a call from him asking, if there is anything that we can do to maybe help them for the current point. And at that point of time, actually, there was absolutely nothing that came to mind except trying to put them into some place, but that didn't happen. But then next day, as a result, what happened was the idea of putting together at least something that keeps them fed while they are traveling came to the thought, and that's when it was initiated. And then we had, and so for by profession, I'm an entrepreneur, but for this cause, we are more of a society.
Yes.
In our colony known as Sarita Vihar, and we then came up with this concept with 3-4 other people, Mr. Vijay Kher and Ram Prakash, and one Mr. Harish Bhargav. We took this up from women and decided that we instantly need to find a way to ensure that people don't stay hungry. And that's when this community kitchen concept came up in Sea Pocket, Sarita Vihar. And as on date, from the day we started, we are currently feeding around 700 people.
Okay. So on a daily basis, thanks to people like Mrinal Singh, people are being fed. And the idea, of course, is that no one should sleep hungry in the vicinity of where you live. That's the kind of concern that some citizens are showing, because of which today, of course, a lot of migrant laborers are being taken care of by ordinary citizens like Mrinal Singh, who is doing their bit. And that is what inspires us now to think about those who are stranded. We might be sitting in the comfort of our homes, but there are millions out there who are stranded during this lockdown period. Dashmi Rani, if I can come back to you on the point about how you manage this thing in terms of the network, the distribution and the dispersal, whether you face any difficulties on ground when you go and do your deliveries. Are there real hurdles that you face in going about this?
Actually, I'll get an information from the department to collect the medicine from the medical shop, and respectively, some of the from the children to the parents, they have already paid the money, Then just my work is just picking the medicine and giving to the remote villages where the parents are living.
Okay. Right. And of course, you must be getting a lot of positive response. You must be, of course, getting a lot of blessings from the elderly who would not be able to access their medicines without someone like you helping them out. What is the kind of response you get? And any personal experience that you want to share with us, the kind of personal satisfaction probably that this brings you?
Yeah, definitely. I would like to share. I got a request from the daughter Swati to his father, who is 76 old year. He stays in an Osur, Tamil Nadu, Bangalore, and senior citizen apartment. And I went there and I gave the medicines, and I felt that personally the person was very much happy, and he saw his own daughter came, and he was blessing me, and that was much enough for me.
Right, right. That feels good, and that's very rewarding, isn't it? To see the smile on their faces, knowing that somebody is helping them out in a time of crisis. Of course, that is again something that we all must also get inspired to think how, with little bit of effort, with little bit of thinking, there are many others out there who can be helped and assisted. Mrinal Singh ji, if I can ask you also about the response that you get. Is there anything from your personal experience that you like to share with us? Anything that you remember from the last few days of in your interaction with those who are needy and who are underprivileged? What is the kind of response you get? Any anecdote that you would like to share with us?
See, the basic, I think one of the key takeaways from this is that despite whatever the government is doing, despite whatever they are trying to reach out there to the needful, I think individuals, communities need to step up and try and ensure that take it on to themselves. We are just doing a small part. I guess there are many others who are doing it. There are many more who are needed. When you see actually the plight, it starts with a plight, and then when that converts into happiness, when somebody receives that food packet knowing that my meal has come for the day, that's a satisfaction that is beyond words actually. And the good part around it is that we feel as a community. And when I say a community, I would practically everybody in this locality of Saritagar is involved. We are doing it in Sea Pocket, but there are other pockets who are there in some form or the other. Individuals on their own have been contributing by way of by way of flour, by way of dal, by way of other things. So now the word has spread. In fact, yesterday we got a call. Yesterday, I think because of this initiative, Sumanji got a call. There were 45 daily wage laborers who are stuck up without food. And when they, I think, heard of this initiative, they called out to him, stating that they don't have food. And today we are ensuring that it reaches them. So, and this what we have learned from this is also that apart from the food packets, we are also trying to go bring in dry ration to ensure that people have a month's ration on them during this time, because this is not going to go off very easy. So we want to be equipped to be able to serve for a longer period.
Right. So you are making those long-term plans, but I want to ask you, when we saw those pictures of migrant laborers, all of us were affected, but very few like you have actually decided to do something about it. From your story, what it appears, and since you said that some of your neighbors have also pitched in, and there are others who pitched in, oftentimes it just requires that one initiative, isn't it? A lot of people want to do it, but they are probably waiting for that nudge or for that push. Do you think that we are not fully capitalizing on all the other people who want to help, but they need some leadership, and someone like you is providing that, isn't it?
That's. I think you're bang on. I really don't think. I mean, as a community, especially in India, I think everybody, given a choice, would want to do something for people who are in need. It's just providing a medium. And I personally feel that we in our community are lucky that this initiative happened out of a noble officer. In fact, the first day it happened, and I actually sent out a tweet very clearly saying a noble initiative, noble cause by a noble cop.
Right.
So I think that nobility is there in everybody. It's just a matter of bringing people together to ensure that there is a channelized.
Mrinal Singh anymore. I just hope the production team can reconnect the line while I take a question with Dashmi, if I can, Dashmi, if you can hear me, we were talking about this point about how it takes one person to take an initiative sometimes and a whole lot of others can join in. You must have inspired many others, of course, with your initiative, but it takes a lot of courage to do it on ground. I also want to know that have you received enough cooperation from the authorities, because again a lockdown is in place, a lot of areas are out of bounds. Do you face any practical difficulties when you go around in your bike? Do people give you those surprised looks?
Yeah, definitely surprise looks are there. All the policemen and the cops were seeing me like, why the lady is going like this. And after they'll stop and inquire me and I tell the details. Then they were happy and again they'll send out and they will tell me, be safe and ride slowly.
Okay. Right. So you are getting the kind of cooperation. I want to reiterate once again that even though we are saying that this is a virus that does not discriminate, it can affect anyone, it's a leveler, but it's actually not exactly true. There are people who are hit harder than the others. Take the instance of migrant laborers, take the instance of senior citizens. They are the vulnerable groups and they do have difficulty getting even the bare necessities, the basic essentials on a day-to-day basis. Something that we may not always be aware, or it may just be visible for us, and yet we do not exactly empathize. But people like Dashmi Rani and Mrinal Singh are those who actually empathize, who actually make an effort not just to see but to observe, and not just to hear but actually to listen to their voices. I mean, it has haunted all of us to see those migrant laborers in hordes trying to leave the city, and so many of them had said that we do not have enough to eat. We've gone without food for 2 to 3 days, and it has taken the initiative of a few good Samaritans to build up a system so that they can get their daily food every day. Dashmi Rani, if one last question to you, but how you plan to go about in future? Have you made any plans beyond the lockdown period? Are you still going to be involved in these kind of philanthropic initiatives?
Yeah, definitely. I'll reach out the people. Yeah, definitely. I'll take an initiative and I like to go on around and help more people.
Okay, that's a nice message. This, of course, only makes you want to do even more. So that's a nice point you made. Let me ask that to Mrinal Singh as well. Do you also feel similarly that this is only a little bit that you're doing, and perhaps it inspires you to do even more going further in future? Have you thought of any plans for yourself? Because all this effort that you're making is to address the collateral damage, so to speak, of the lockdown. But beyond the lockdown period, what exactly are your plans?
The collateral damage for the lockdown is actually stems from another activity that we as a community, and especially we have a Mitra Mandal who takes it upon them. I think they've been doing it for the last 20 years now, between Mr. Vijay Kher and Mr. Ram Prakash, Mr. Harish Bhargav, the 3 other people as a part of this. They take it onto themselves to ensure every week there is a preparation of food right just next to our colony in the market, where all the daily laborers, the rickshaw wallahs, etc., they are fed. So this is an offtake from that, and that continues. This will continue as long as it is required to, till we are sure that what has hit us is out of our way and people are coming back to normalcy.
Right. Right. So you are going to, in fact, stick on, make sure that till normalcy returns, those who you are feeding right now continue to get their supplies, continue to get food every day. Okay, I'll just give you closing comments now to you first, Dashmi Rani. Any lesson that you have learned, that you have picked up from your experience during this period? And it can be general life lesson as well. I mean, we all have perspectives now, new perspectives on life after seeing how everything has come to a standstill. Humanity has been brought to its knees, and people are all locked down in their respective homes. Has it changed your perspective in life in general? Any lesson that you can share with us from your experience, Dashmi?
Yes, definitely. Be positive and think positive. Everything will be sorted out soon, and don't be panicked and stay safe.
Okay. Okay. Right. So good points. No panic. No, there is no need to panic. As long as people like Dashmi are there in our society, I guess we can smile a bit and think about people who are benefiting from those good Samaritans like Dashmi. Mrinal Singh, your final words on your lessons from this experience of reaching out to the poor and the underprivileged and the migrant laborers.
Okay, so the one takeaway is that we should value whatever is there in life, and no matter what happens, always have that little window to take care of. There is a lot that we do not see on a day-to-day basis till some crisis like this comes up, but then we have to realize that this is something that is there in society which should not be left. And the other thing that I've learned is there are a lot of good people around you. There are a lot of good people who want to do good. It's just a matter of getting together, holding hands, and ensuring that the underprivileged are not left in their state, not only during crisis, but at any point of time in their lives.
Right, absolutely. And I'll take that point to, in fact, conclude the show that you made about how we have to metaphorically hold hands. Of course, at a time like this, that is one thing you have to absolutely avoid. No handshakes allowed. But think about it in spirit, in terms of the humanity coming together, because together we have to beat this. This is a war, no less, on humanity at large. We are all together in this, and therefore it is so important for us to think about those who need our help and assistance at a time like this. And I salute the courage and the compassion and the integrity of people like Mrinal Singh and Dashmi Rani, who have come out and reached out to those who need help at a time like this, those who are left stranded, rendered homeless, or even jobless, because their day-to-day livelihood has been snatched away from them. Think about it. You are only thinking of perhaps being confined to home. Many of us are thinking about that, but think about the others who do not have the guarantee of 2 square meals a day. But then, like Mrinal Singh ji just said, there are a lot of good people. It's not all doom and gloom. There is a lot of positivity around us. We need to pull in the positive energies together, and probably then we can do a lot of good as well. Help out, pull out those who are in a state of crisis right now. And that's why we are featuring Good Samaritans every day here on Inspire India. I would like to thank Dashmi Rani for sharing her story. Those visuals will remain with us of a woman taking a bike, going out on the streets, getting those surprise looks and delivering medicines to the elderly. And Mrinal Singh, of course, with your community kitchen, feeding so many people every day, making sure that nobody goes hungry. I don't think anything can be more noble than that. This is out of pure humanitarian concern. The compassion and the empathy is something we truly, truly appreciate. Thanks for joining me here on Inspire India. I thank my guests for sharing their stories.